You've been taught to wait it out, to push through the mood swings, the weight gain, the exhaustion, as if that's just what midlife is supposed to feel like. And even when you do ask for help, you're often met with blank stares or outdated advice that makes you feel like you're the problem. But the truth is, women's health has been misunderstood and under-researched for decades, and it's time to change that. This is Women's Health Unwrapped. I'm Nicola Fondell, and each week we strip back the noise around health and habits so you can finally feel clear, capable and confident in your body again. And today I'm joined by UK GP and menopause advocate, Dr Itunu Johnson-Sogbetun, or Dr Sho, as she likes to be known, to explore the history behind the misinformation, the real risks we should be paying attention to as women, and why prioritising your health now is the most powerful thing you can do for yourself and the next generation. We dive into all things hormonal health, menopause, HRT, and much more. So I know you're going to enjoy this conversation. Hi, Itunu. Welcome to the podcast.
Oh, hi, Nicola. Thank you so much for having me. It's great to be here.
It's a pleasure. Yeah, it's an absolute pleasure. Really excited for this conversation. Before we do get into it, I'd love to just get a little bit personal with you and ask you what your most impactful healthy habit is in your own toolkit at the moment.
So for me, it's really about what I put in here. So I often talk about what I put in here, but for me, I'm being really mindful about what I put in here. So at the moment, I'm being really careful with social media and news content that I consume. So that's what I'm currently doing. It means I'm rarely on social media, which has really helped my focus and concentration and given me a lot of peace. But yeah, so that's what I'm doing at the moment.
Oh, brilliant. I love that. And I don't think I've had any guest ever share that as their most impactful habit, but it's definitely something really important. And if you're listening, Tuna was pointing to her head saying she's focusing on what's going in up there rather than only on what goes in our mouth. And one of the phrases I use is how we fuel our mind and body, because
That's
I
it.
think we can think of fuel only in the sense of what we eat. And that's the big thing that matters, is the quantity of what we eat, not necessarily the quality either. But you're right, everything that we take in any form, even our own self-talk, can really impact us. But right now, the world isn't the nicest of places, and there's a lot of noise on social media, full stop. So that's great to hear it's having such a positive effect on how you're feeling. Do you feel as though it's been something that's, or even at the start, was challenging to try and build as a habit?
So I think what I now do is I probably check it like twice a week, something like that, rather than feeling I have to consume daily. That's social media. With the news, I do check in daily because, I just kind of want to know what's happening in the world. But I only check one particular news source rather than multiple. I've deleted the news app. I don't need interruptions throughout my day of notifications of whatever is happening in the world. I check it once on a particular website that I feel, and just once a day. But with social media, I check it maybe twice a week. And it's been really helpful to just keep my mind kind of clear. And instead, I'm filling my mind with other things that are sort of more healthy and more hearty for me. So like podcasts, audiobooks and things like that. So I enjoy listening to history or podcasts and helpful audiobooks, things like that.
Oh, fantastic. Yeah. So as this episode comes out, we are in Menopause Awareness Month, and we will have just celebrated Menopause Awareness Day itself on the 18th of October, just before this episode is released. And you will have spoken at the Pause Live event in London by that point. And that's because you are a menopause ambassador and very passionate about women's health and improving the health of women globally. So I'd love to start unpicking all of that with just having you share why in your role as a doctor that's become kind of a niche and something you're really passionate about and dedicating this time and effort and energy to speaking about it?
So I'm passionate about all of women's health because it's really, really important, from puberty to period problems to pregnancy to postpartum to perimenopause, menopause, and beyond. I want women to live their very best lives. I myself have had challenges with my own health. I've suffered from PCOS since I
Mm-hmm.
was in my 20s. And as a result of that, I've had multiple health challenges, including cardiovascular health complications such as high blood pressure, pre-diabetes, but also things like infertility I've struggled with. I've had pregnancy loss at 24 weeks. And now I think I might be starting to enter very early perimenopause because I'm heading into my late 30s. So I'm in my late 30s now. And so my whole journey mirrors and impacts why I am so passionate, because I've had challenges with my PCOS, particularly in the early days, and with my health. And I'm very privileged that I've been able to get culturally competent, really good care that has meant that even with difficult challenges, including some of the mental health complications of PCOS as well, mental health challenges, I'm well, I'm thriving, I'm able to advocate for women. I'm mindful of those who are not able to. And so this is what really drives me to advocate for women. Now, when it comes to hormonal health, it's, you know, PCOS, it's all through PMS and all the perimenopausal symptoms, it's menopause and perimenopause and postmenopause. So I'm very aware of many of the similarities that flow through hormonal health throughout a woman's life. It's postpartum, it's pregnancy. And I want women to be able to advocate for themselves, get the help they need, right? And so
Yeah.
this is why I spend a lot of time educating women to empower them, but also advocating for women so that when they go to these spaces, they're able to actually get the help they need from people who are in a position to help them in the way that they want to. Because a lot of the time, the system means that there's just not enough resource, whether it's time resource, whether it's staffing resource, whether it's education resource. So women go for help and then they don't get the help they need. And this can't continue. And so that's why I'm really advocating.
I love that. And you've been, as you've just shared there, on both sides of the fence in terms of being a patient and someone struggling with their hormonal health and then working in the healthcare system. And what, from being able to experience both sides, patient and provider, if you like, have you learned and now take into the work that you do to make sure that women can get the support? Because certainly, well, actually, I'm going to rephrase that, because I was going to say in menopause, but it is all of the way through. I mean, we're hearing so many stats around how long it takes for someone to have a diagnosis of something like PCOS or endometriosis, and how many years that can sometimes be. So, we know it can be difficult for lots of reasons for women to have the right support and get it quickly and timely as well.
Yeah, absolutely. I mean, for me, I always want to give the very best of myself in every patient consultation because I'm so aware of how that's important. As I say, from my own personal experience, I remember the very first experience that I had that was life-changing for me when it comes to women's health was with period pain. When I was a medical student back in the late noughties, I was really struggling with period problems. I'd always had period problems, but through school, I'd just miss a few days and it was fine. But in medical school, you couldn't keep missing a few days because I was actually failing. And I was too scared to use hormonal treatment. I tried, painkillers and things like that, but it wasn't working. And so I was very fortunate to have a tutor who also happened to be a gynecologist. And she said to me, what's going on? And I said, this is going back, I've got an African mother. And she's like, You can't use the contraceptive pill. It can impact your fertility. God forbid, all this stuff. She'd made me frightful. Whereas as a clinician, I knew some of the facts, although not all, because I was still a medical student, but, but I was still frightened. And so she then, explained to me, and she said, what, why don't you just try it? And at the time, it was the progesterone only pill. And I tried it and it changed my life. I was able to go through the rest of medical school. I was able to do my training as a post-grad doctor on the same medication. And I was really on that medication until I decided I wanted to try and have a baby later on. And it really got me through. And that was when I understood that misinformation or not having enough information can really impact not just the quality of a woman's life, but also her potential. Imagine. And so this is why, like, for me, it's my lifelong promise that I will continue to advocate. I'll continue to provide women spaces to ask these questions, because this is not just about quality of life. It's also about impact and potential that women have that is often limited because of some of these issues like PCOS or endometriosis or adenomyosis or fibroids or menopause, all these different health problems that women have.
Yeah, it's just so powerful. I can hear the passion coming through from you. And yeah, I'd love that you've taken this on. And now, thankfully, we have lots of other professionals like yourself who are standing up and speaking out and really trying to advocate for women. And one of the things that I know you speak about, which I'm interested to dive into, is the Women's Health Initiative study that just got so frustratingly and sickeningly and suddenly and all of those things really negatively impacted women's health for possibly a whole generation because of what was released in that study back in 2002. And I'd love you to talk a little bit about that and then share whether you think there has been now a very positive shift away from it, or are we still mopping up some of the mess that left behind?
Right. So obviously with the Women's Health Initiative study, what happened was at the time, they were looking into assessing how HRT impacts women. And one of the endpoints they looked at was as to whether it increased the risk of breast cancer. And so they analyzed the study wrongly in a cohort of women that wasn't really appropriate, and then came out with the conclusion that wrongly said that HRT causes breast cancer. And so a whole generation of women were scared and stopped their HRT treatment. And I have to add, the type of HRT treatment that was in more common use at the time was oral HRT. A lot of it was synthetic. Now we've had that data re-looked at, but also we've had more studies to show us that actually HRT only increases the risk of breast cancer for women by a very small margin. So we're talking about 0.5 to 1%. That's 5 to 10 in 1,000 women. That risk is so small. Women are much more likely to die from heart disease, which HRT protects from, for women who start it within the first 10 years of their menopause. And then we also now have these modern body identical HRT estrogens, which are the same as our body produces, so estradiol, and we don't have to take it in oral form, because orally, when it takes it, bypasses the liver and increases clotting factors, so it can slightly increase the risk of blood clots, but that risk is completely eliminated by having it topically. We have now gel, we have patch, and also now spray as well. So we have 3 different topical options, and within that we have multiple different brands that produce, so there's so many different options for treatment. And of course, if you're well and don't have any medical problems and prefer oral, you can still have natural oral estrogen. It's just that slight increased risk of blood clots that's there, but many women are on it. So as I say, for the vast majority of women, HRT is safe and it's effective treatment for the menopausal symptoms. But not only that, it has protective benefits, which is for our heart health and bone health. And there's ongoing research to see how it also might improve other aspects of women's health. And we certainly see that there's radical quality of life symptom improvement, which is so important because it impacts what I just mentioned about potential. So many women, get pushed out of the workplace, are unable to continue in their relationships, are feeling unable to thrive because of menopausal symptoms. And that makes them less functional members of society. We know how important women are to society. In fact, one of the things that I often talk about is how women still disproportionately carry mental load for society. We are often the workhorses for society, which we don't want to claim that because we want to not be that workhorse. But the point is we're so important to society. So we can't afford a society to lose such important, experienced females. And so it's vital for the individual woman, but for us as society, to encourage women to get the help that they need so that they can thrive. And of course, we also need to address the issue of the mental load.
Yeah, here. If you are a regular listener, you'll know that everything Itunu's saying is what I'm all about and try to share in the way that I can, because you're so right. There's so many women, and I've spoke to some. I produced a white paper at the start of this year looking at the real impact on women's careers through menopause, and spoke with lots of women privately about their own experience, and how for many of them it had resulted in them totally leaving the workplace or leaving behind a career. Women who worked in finance, in education, in banking, in travel, all kinds of industries, who'd had to step down or totally away because, and in almost all of the cases, didn't know what was happening, because going back a few years, we didn't have the knowledge that is now thankfully starting to be shared. And so they'd struggled in silence and, without support. And so that Women's Health Initiative study, I know from lots of the events and people I've spoke to, and I'm sure you say this even more, women are still going to see someone at their general practice, whether it's a GP or a nurse practitioner. Not every practice has a women's health or menopause specialist. Mine doesn't, for example. And they're being turned away, they're being offered antidepressants, and I have kind of experiences with my GPs like, oh, no, you don't want to take HRT. It's not beneficial. There's so many risks. And there are women who are still believing that it's detrimental to them, and therefore not having the protection of what HRT can offer, as well as the quality of life you've just talked about by taking it now.
So yeah, I mean, to me, that's really sad because it's still an ongoing reality. We're grateful for people like Davina and, the Menopause Initiative, the Menopause Alliance, lots of different people who've come together to move the conversation forward, and let people know that HRT is really, really helpful. So there's a lot of people who know, but then firstly, many of the clinicians are not up to date, as you mentioned. And then also, there's still a lot of women who are in fear because they can so remember the news reel saying HRT causes cancer, and they're so afraid of cancer. We know that breast cancer is a very treatable condition. Of course, there are still a small proportion of women who sadly die from breast cancer, but the vast majority of women who get breast cancer anyways in this country will survive at the 5-year mark and beyond. And so when we think about heart disease in women, even though that's a bigger killer, and dementia, these are bigger killers of women. Women are not necessarily attuned to it in that way, the way they fear the breast cancer. And so I think there's a lot of education around that. But also, when women have some knowledge but don't understand the full scope of the information around the other benefits and the quality of life improvement, then it makes them still feel, oh, and they're not thinking about the bigger picture. But again, this is why we need to educate, we need to empower. So we need to turn, I told you about my misinformation and fear. So I think very much understand how people can live in misinformation or half truths and fear. And so we still have a lot of work to do. Firstly, to make sure that the professionals are up to date and understand the benefits, and stop overstating the risk. It's not that there is no risk. No medication is no risk, but it's very low risk. For the vast majority of women, the benefits outweigh the risks. So we need to be preaching that and letting women know that. And then, of course, it's personalized. Women need to make their own judgment with the clinician. But of course, we need to be speaking to clinicians who know, who are aware.
Yeah.
So it's a double act. So we need to educate women and empower women and challenge misinformation. And there's a lot of work going on to do that. But we also need to educate and support the workforce, whether it's doctors, nurses, pharmacists, paramedics, people who are working in that space, so that they feel upskilled to be able to support the women when they come, and they're giving them adequate information so that women can make a personalized choice based in truth, not fear.
Exactly. And so being behind the scenes, what are you seeing shift in terms of those clinicians and professionals now having better training and information? Is it moving at a greater pace than it has been? Is the momentum there? Are people interested in having this training? Because I know this workforce you're talking about are under extreme pressure. We know that the NHS has been massively impacted since the pandemic.
So the workforce is under extreme pressure. I can't explain. We're supposed to do, as GPs, assessments in 10 minutes, which is
Mhm.
pretty much impossible for menopause, because one of the things we haven't talked about is that menopause is biopsychosocial. So obviously there's the biology of the low estrogen needing treatment, best treatment being HRT, but there's also the psychological and the social and the environmental factors that impact the menopause in and of itself, which includes sort of mental health problems, which may be related to the biology, but may be coexisting. There's trauma, all sorts of things that women have gone through. I often say that it's impossible for women to get to their late 30s and early 40s and have not experienced some kind of micro or macro trauma. And then you add in the social factors. So, as I say, many women who are midlife are carrying so many loads, including often raising young children whilst supporting elderly parents at the same time, whilst also working full time. It's absolutely crazy. So when you bring everything together, you have to explore the full and complete woman in a consultation. How do you do that in 10 minutes? It's impossible. And that is the expectation. That's what is earmarked for many, many doctors. So they just, they're not able to do it. So we do need more time resource. We need more skill resource, and we are educating. What menopause webinars are often sold out. There's a lot of interest. The BMS have now released an incredible course. I've done it myself as well as the advanced specialist. So advanced course. So I'm a menopause specialist registered with the BMS. But the BMS have a course that is open to all clinicians to be able to get really extensive menopause training. And so there is that training out there. There's the MREF, which is the Menopause Research and Education Fund, I believe. That's what it breaks down to. They also have a fantastic course. In fact, I'm teaching on that course sometime next month, and it's very financially accessible for clinicians as well. So there's a lot of places where you can get that accurate information. The FSRH, which is the Faculty of Sexual, well, now the College of Sexual and Reproductive Health, also have courses for, and then the RCGP have education as well for GPs, and lots of different other professionals like nurses and pharmacists have similar with these organizations and their own local organizations as well. So there is a lot more education, but again, it's people who are seeking to be updated and upskilled. Some people just are too busy, understood. And so it hasn't quite filtered as far as we would like it. I think those who are interested are upskilling and getting that information and getting that skill set. I certainly feel that many more of my colleagues are a bit more au fait with the facts of HRT and menopause than maybe 5 years ago. Um, and so I definitely feel that, but I still think there's a long way to go.
Yeah, I'm hearing that as well. There's some doctors that I've been chatting to locally. One I was speaking to recently who now does private consultations at one of the private hospitals in Newcastle, the Spire. And she was saying that those patients come in and they've paid for this private consultation for an hour. And she said, honestly, it could be longer than an hour because, like you said, there's often, it's not just the symptoms that are at the surface, it's everything that those symptoms are rippling out and causing, as you said, perhaps in your emotional health, in your overall well-being, struggling with your career, and then to start to begin to advise them beyond HRT in terms of perhaps some lifestyle changes around their diet or exercise or stress and sleep and all of that, and signposting them for resources. She said, these women know that that's only the beginning of the journey they're on to improve how they feel and their health, but they just walk away with their shoulders down because someone's listened and given that time. But in a normal practice, that a 10-minute appointment is not helping women, is it? And so I'd love to move to that because you are such an advocate for women getting the support they need, and that's where we started. What would be some tips you'd share with someone to help prepare for a general GP or nurse practitioner review, and how can they get from that what they really need and the right support?
I think the first thing is perhaps not to expect to explore everything within one consultation. The good
Right.
thing about general practice is that you're able to see people, multiple times over time. So I would prepare a list of the most important symptoms, and if you can even keep a diary or something that you can use to and share your views, and also express how things have changed over time. You can take a friend or family member along with you if you feel that you need that extra support to be able to advocate for yourself. I think that you also need to not be afraid to ask for a second opinion or look for someone else if you're not getting the answers that you need. But again, it's just managing that expectation of what can be done within the 10-minute appointment. If you can request a double appointment as well, that's often helpful. The clinician would be grateful to say, this is a very, this is menopause, so it's quite complicated thing. So I would appreciate, when you're speaking to the receptionist, if I can get a double appointment, because I have quite a lot to discuss. Because there's everything. There's, sexual health, genitourinary medicine. We haven't even mentioned that. Those symptoms, the vaginal dryness, the pain with sex that often occur, that has to be explored. That might need also intervention alongside all the other physical health symptoms and the mental health symptoms that occur with the menopause. This is complicated stuff. And as you say, the lifestyle stuff, sometimes, we're spending time talking about mental load management. It can take me sometimes 15 minutes to discuss mental load management as part of the menopause consultation when I talk about which this occupational therapist, fantastic occupational therapist, taught me the approach of eliminate, delegate, and facilitate. And we often go through in that woman's life to reflect how can she do this in her own life and apply it into her own personal life. As I say, in private consultations, because I do private consultations as well, that can take 15 minutes as part of the consultation, just that alone. So when we're often not able to solve everything in one consultation in the NHS. And so what I try to do is pivot on the most important aspect for the woman in that very first initial consultation, and whether it's mental health or genitourinary health or the hot flushes and physical health symptoms. And then we book a follow-up to deal with the rest, making sure that
Yeah.
we don't leave anything out. Because as you say, the lifestyle stuff is so important. What you're eating, how you're moving, nature, social support, sleep, all of these things, mental load management, they're the pillars of menopause management. And we can't not put that in, because otherwise it's like saying, oh, someone has a cut wound and you're just saying, okay, we'll just put some plaster on it, and it's still dripping blood, and you're like, oh, the plaster's on there. Saying, oh, we've given the HRT, because you haven't done the stitches to pull the skin back together, stop the bleeding, and then when you put the plaster on, it works. Because you then hear people saying, oh, the HRT didn't work, and then you discover that actually a lot of the fundamental issues, the lifestyle stuff wasn't addressed, the psychosocial stuff wasn't addressed, and so of course the HRT hasn't worked effectively.
Yeah. And that's what I talk about when I give talks or work with clients, is building that toolkit and knowing that HRT, if it is for you, is one of the tools in the toolkit, but your lifestyle is the bigger part. And obviously this year, the focus for World Menopause Day is lifestyle as medicine. And that's looking at all of the habits that you have, how you live, the choices you make over the way you move your body, what you eat, the quality of what you eat, how you manage stress. And all of those pillars, as I talk about as well, are absolutely critical to you feeling better now and having strong health now, but most definitely protecting your future health. And I think that's a big shift as well, isn't it? To have people not just react, which our healthcare system generally is set up to work in that way. You have a problem, you seek advice, medical treatment if you need it, and solve the problem. Whereas we need as women to protect our health because of these greater risks we are now facing with lots of the illnesses you talked about, with cardiovascular health, metabolic health, and dementia, our brain health being something that I think, again, we are very well educated on.
Absolutely. And it's important to understand that post-menopause, we're at increased risk of these health problems. And as women, we're at higher risk of dementia. So as women, we may live longer, but we actually live longer in more ill health. So that's one of the things that we need to really, really address. So it's not just about longevity, it's also about quality of life, And so we need to be really thinking around the holistic picture of women's health. Is not just about our reproductive health, but actually how strong are we? And the lifestyle stuff really, really underpins that. How healthy are our minds? How able are we to manage the challenges of today's world, which is so challenging, and all the different aspects of it.
Yeah, and if you are interested in this, last week's episode is on lifestyle medicine, what that term means, why it's the focus of this year's World Menopause Awareness Month and Day, and me talking through the 5 pillars that I use: mindset, movement, nutrition, sleep, and stress. So this marries up really nicely with the conversation we're having right now with Itunu. So to wrap us up, I'd love for you to give the listener 3 simple steps that she could take to make sure that she is advocating for herself and getting the support that she needs. You've given lots of tips already. So yeah, what would be those kind of 3 ones that she could take to improve her health?
One of the things that, before I do that I want to say is that it's often more challenging for women with other challenges, such as whether they're from an ethnic minority background or from the more socioeconomically deprived area, or if they are from a different sexuality, or whatever their challenge might be. It's often more difficult for these more marginalized women to even get the help. It's difficult for any woman, but it's also more difficult for women from these sorts of backgrounds. So I think it's really important for us to understand that and acknowledge that as well. And so this is why I often talk about culturally competent care, which is care that understands your context, understands your trauma, respects your trauma, and meets you as an expert in your body, and we as an expert as clinicians. So I think that's going to be my first tip. Recognize that you are an expert in your own body. The doctor is an expert in medicine, and it's a meeting of 2 experts. And so you shouldn't feel that it's an uneven relationship. So own your own expertise in your body, number 1. Number two is write it down. Whether it's on an iPad or on an iPhone in notes, or you take a piece of paper more traditionally, or you take a diary, whatever you take, write it down. And this is because when you get into the room, you often forget what you want to say. And so when you have it written down, you can explain yourself and reinforce your thoughts. And you've also ordered your thoughts when you've written it down. So it's easier and clearer for whoever's listening to understand. And mark out your priorities. So write it down. That's the third thing. And the second thing. And then the third thing is get a second opinion if you are not getting where you need to go. Don't be afraid to get a second opinion, because sometimes it's that the person doesn't have the knowledge, and instead of them to admit that they don't have the knowledge, they kind of send you away or minimize your concerns. Sometimes it's because they're under pressure. You don't know what's going on in their day. Try again. Don't give up because the first person you spoke to minimized your concerns until you feel heard and listened to. Now, it may be that what you want is not appropriate. Does that make sense? But a lot of the time, if you still feel heard, if the person who has spoken to you and has listened to you as an expert in your own body has explained why, then you can understand, oh, okay. Because I'm not saying that, demand what you want from a clinician. That's, it's a meeting of two mutual experts.
Mm-hmm.
A clinician is not going to want to do something that's unsafe for you. Does that make sense? But it's about recognizing your own expertise and their own expertise. But when you feel listened to and heard, you will know what that feels like. And if you don't feel listened to and heard and acknowledged and validated, then get a second opinion.
Yeah, I think that's all great advice. And I love that first point of being the expert in your body. It's not something I think most of us are used to because we just haven't been brought up to think and connect with ourselves in that way. But yeah, I think at this stage of life, it's so important. And I really advocate for younger women, especially when I'm working with corporate teams and you've got a big range of different age ranges and stages of life. For those younger women who are in the 20s who may think, oh, this is not really for me, but to understand their bodies, because the younger you are, the more self-awareness you have, and as you explained in your story, we can all experience hormonal health challenges at different ages and stages of our lives. They might experience something when it is time to try and conceive, and that could be the first point where it comes to the surface, that they need to be more connected and self-aware. So yeah, I think that's great. And I often share the Balance app, which is the free app that you can use to track symptoms, and it can even combine everything up and print off a one-page report so that you have got all
Absolutely.
of that there, and then go in with that ready to, because we know appointments are focused on one specific problem. So if you start saying, oh, well, I'm having some joint pain and I'm also feeling quite low, but then I've been struggling with perhaps some discomfort when I'm trying to have sex or low libido, and then it's kind of for the doctor, which one? Whereas if you say, actually, I've got quite a multitude of symptoms, some physical, some mental, emotional, and I've gathered it together on a list, and I can imagine that's really helpful for you as the GP to say, okay, let me look, and then you can decide where to take the conversation next.
Absolutely. And in addition to the Balance app, the well-being of women also have something similar as well, which is really, really
Okay.
helpful. So there's lots of different resources, but Balance is great. Yeah, absolutely.
Oh, fantastic. Well, please keep doing what you're doing. I think you need some kind of position in the government, Itunu, to be this women's health ambassador, because
Oh,
we
there
are
is
missing
already a
women.
women's health
Yeah,
ambassador.
I
She's
know, but they're not
amazing.
doing it. Oh,
She
well,
is
that's right.
amazing.
You
She's
keep.
got Prof. Leslie Regan. She's actually amazing.
I have heard her speak. She's good.
Yeah.
But I think, yeah, we need more voices in there around the table. That's for sure. So yeah, I've loved speaking to you about this because this is my passion, inside and out, for lots of different reasons. I've got my own health story as well, and yeah, it's to help women right now, but as importantly, to help them protect their health and have that health span for as long as possible, because I've seen firsthand what happens when your mobility is impacted or your mental health's impacted, and life can quickly decline in quality and lead to lots of problems. So yeah, we want to live long and strong, and I'm pleased you're on board and campaigning for that. So thank you so much for your time. I know you're not on social media, Itunu. Do you do?
I am on
Do you
social
have
media,
anything?
but I
You
just
are,
don't check
but
it that regularly.
actively.
I'm my
Where can
social
someone
media
find
is
you? Yeah.
at Dr Sho Care, so DrShocares, and I have got my private clinic as well, which is drshocares.com, DrShocares.com. And so you can find me on that, my website,
Brilliant.
social media. So I'm on all the different social media platforms with at drshocares.com. I've also got my personal page, which is just at Dr Itunu. But that's more kind of my personal page as well on social media. So yeah, that's where I'm at. I'm on LinkedIn as well.
Well, yeah, definitely connect. Let her know what you've taken away from the episode. I'll pop the links into the show notes so that you can quickly choose where to go and find out more and say hi. So thank you again. It's been fantastic.
Thank you so much for having me.
You're welcome. If this conversation opened your eyes, if you've ever walked out of a doctor's office feeling dismissed or wondered if you're just supposed to put up with how you feel, know this: you're not the problem. And you're not alone. You deserve healthcare that reflects the reality of women's lives. And the first step is recognising that your health matters. As Dr Sho shared in her first step of what you can do to take control of your health, connect with your body. Be the expert, understand what's going on. And this means taking a bit of time to get more self-aware. And that's why I created the Midlife Reset Quiz, to help you understand what's going on beneath the surface and what small changes could have the biggest impact on your energy, clarity, and long-term health. As we shared, we all want to live a long and strong life. So head to the link in the show notes. It takes just a few minutes, and it could be the wake-up call that helps you stop surviving and start thriving. Thank you so much for joining us today. I hope you enjoyed this incredible and inspiring conversation with Dr. Sho. I look forward to seeing you in the next episode.